I received a report mentioning an epiretinal membrane, but what is that? Will I need surgery? Hello, everyone, and welcome back to our channel. This is Filipe Lucatto once again talking to you about a variety of very interesting topics related to retinal surgery. The purpose of these videos here on the channel is precisely to help you who went to a consultation alone, heard the name of a complicated disease like epiretinal membrane, for example, and came home full of doubts. You don't really know how to explain what your condition is, and you find you can't talk to your family and explain why you might need surgery or what that complicated diagnosis written on your tomography exam actually means. So if that's your case, feel free to leave your questions for me in the comments section. I'll respond, and as much as possible, I will try to answer and help clear up all of your doubts. Don't forget to follow the channel and leave your like so that the YouTube algorithm understands that this video is relevant and can share it with other people who have the same questions as you. So, let's get right into it. What is an epiretinal membrane? The epiretinal membrane is a thin, delicate film that forms in the central region of the retina, an area which is more commonly known as the macula. The macula is responsible for our detailed vision. It's responsible for our central vision. Every time I want to focus on something, for example, when I want to read something or look at a specific point of interest, it is my macula that is aiming at that particular spot. And this film, which often forms seemingly out of nowhere on the retina, can gradually contract and cause visual image distortion. So the patient then starts to notice that images become blurrier and they begin to lose their sharpness. Sometimes when they look at a straight line, they see waves or distortions in that image. This is a common symptom called metamorphopsia, which is one of the main signs that surgery will really be needed for this epiretinal membrane. But then what? Building on that, does every epiretinal membrane need surgery? No. Stay calm. If you read in an OCT report, if your tomography says you have an epiretinal membrane, which by the way, OCT is the exam we use to diagnose and monitor this condition, don't panic. The membrane doesn't always require surgery. In certain cases where the membrane is particularly thin, not very adherent, causing little distortion in the macular region and the person themselves doesn't notice much of a change in their vision, that is, and this is very important, they don't have significant visual blurring, no metamorphopsia, and no image distortion. Often we'll simply need to monitor this membrane over a period of time. It could be once every 6 months or perhaps once a year, depending on what your doctor specifically recommends. But in other cases, when it shows progression, when the distortion is significant, even when you put on your prescription or when the prescription is corrected during the exam, the patient still can't see out of that eye. The image is very blurry, very distorted. Then surgery is really necessary. And not only that, sometimes the patient doesn't even have severely impaired vision, but the optical coherence tomography scan already reveals findings that indicate disease progression and a poor clinical outcome. These changes that we find on the OCT are called biomarkers. They also help guide us as to whether it's worth operating on a membrane early, aiming for a better result in the future. So when should you operate? The decision to have surgery obviously is made in discussion between you and your doctor, but it is based on 3 factors: how much the central vision is compromised, how blurry the vision is, what degree of distortion the patient perceives, whether or not there is image distortion, whether or not there is metamorphopsia, and signs of traction on the OCT, especially certain biomarkers that the doctor will know how to assess and discuss with you, whether it's worth recommending surgery right away or just monitoring. If there is a risk of worsening, it's better not to wait too long, because the sooner we treat it, the better the potential for recovery. Because when the distortion becomes very chronic, when it really wrinkles the retina, contracts the retina a lot, the retina develops a kind of memory there, and the photoreceptors, which are the cells responsible for our vision in the retina, start to deteriorate over time. This can be harmful. It can mean that in the future you have surgery to remove the membrane, but your vision doesn't improve much. Chronicity, the length of time the membrane has been there, is also something that has a big impact. And what is the surgery like? What is the recovery from the surgery like? Is it quick? Well, first, the surgery performed is a vitrectomy. It's a surgery. Vitrectomy is a procedure we perform for various retinal diseases, but the idea is to remove all the vitreous gel from the back of the eye, and using a special, very delicate forceps, we remove this membrane. The name of this procedure is membranectomy. And then when we remove this membrane that's stuck to the macular region, the tendency is for the retina to become smoother, more similar to what a normal retina is anatomically, and over time the retina flattens out more, regenerates, and vision improves. But the recovery of vision isn't as fast as it is with cataract surgery, where sometimes you have the operation and the following week you're already seeing 100%, right? With the membrane, it's a bit slower. This reorganization of the macular region takes more time. So it's important to understand that we expect it will take a minimum of 3 months for your vision to gradually improve. And sometimes it can even take a longer period of time for the vision to become fully stabilized. But the surgery is safe, it has excellent results. The retina takes some time to reorganize, but usually the symptoms of distorted vision, that wavy effect, improve more quickly, and visual acuity also gets better over time. Well, follow-up is essential. If you have a diagnosis of epiretinal membrane, you need to have regular checkups with a retina specialist so they can guide you, compare your previous exam with your current one, and see if the condition is progressing or if it remains stable. It can remain stable for years and you may never need to have surgery for that membrane. But it's important to have this close relationship with your retina specialist to make the right decisions at the right times. So if you have this diagnosis of epiretinal membrane or know someone who does and is going through this, send this video, share it with them. Understanding the disease is the first step for your treatment to be successful. I truly believe in that. Information is absolutely essential for us to understand what we have to face and when we will need to face it or not. And that's it. If you have any questions, leave them in the comments and I'll help answer and guide you in the best way possible. Also follow Dr. Filipe Lucatto on Instagram and stay tuned here on YouTube to learn more about retinal diseases, retinal surgeries, and also cataract surgeries. See you next time.